how exactly the pill works means they will stop the egg from releasing from the body. There are two natural hormones that are present in the body. One, so the pills actually contain a small amount of these. So they were taken every day at a particular time. This will prevent the body from ovulating. So when you don't ovulate, you will not conceive. That is the whole concept behind the pills, right? So what are the three important pills? One is the 21-day pill, one is the progesterone only pill, one is the emergency contraceptive. How do we take the pills correctly? That alone I will tell today. So you start the 21-day pills any day of your periods from first day to the 5th day. The day you get your periods is called as the first day, and then you start counting from there onwards. So you start the pills from the first day to the 5th day, any day, and then take the pills regularly. Every day you should take at the same time, but you should take the pill every day. You should not forget, right? And then once you finish the pills, every pill packet will have a small, there will be like Monday, Tuesday, Wednesday. All the weekdays will be named in the 21 days pills. If you see any pill packet, so preferably just start on the day which you are taking, so that you will have a count. Then once you finish the packet of 21-day pills, there will be 7. You will again get a period. So after that, when you start a period again, from the first day to 5th day of the period, you can start taking the pill. Yes, so this is how you take the pill. See, the pill should be taken at least for a period of 7 days for it to start working. Say, for example, see, ideally you should start on the first day to the 5th day, right? So that is when you have no chance of ovulation. So when you started beyond the 7th day, there is always a chance of ovulation. That is the whole idea behind starting the pill between the first day to the 5th day. Say say you didn't take and you're going to start it in the middle of the cycle. So you always have to use a backup contraception for a period of 7 days. So that is the whole idea behind taking the pills. Okay. And the missed pill concept also I'll tell you today. Okay. See, for you, if you have to take the pill every day, it doesn't matter whether you take the pill exactly at the same time or not. Just take it like Monday, Tuesday, Wednesday. You have to every day take the pill. If you have forgotten one pill, it's okay. You take the pill as soon as you remember, and then continue the rest of the packet as scheduled. If you've forgotten two pills, what happens is your contraception might not be very effective. At that point, what you do is use a backup contraception. You take the pill of that day, okay, and take a backup contraception for the next 7 days. So that is the whole idea. One pill is okay, two pills is not okay. 21-day pills is the combined oral contraceptive pills. That is, it contains the estrogen and progesterone. That is that is what we usually call as oral contraceptive pills. Okay. Right. Then there are the progesterone only pills, which I already told you. So it is commonly available in the brand name of Cerazette. It is not very widely used because it is not very reliable. Okay. The thing is, you have to take that progesterone only pill every day at the same time. Even if you miss any difference of more than 12 hours, means that the contraception will fail. Okay, but if you have the habit of taking the pill, you can schedule yourself to take the pill every day at the same time. It is as effective as a oral, normal, regular combined contraceptive pill. That is almost 92% effective. Okay, so and the advantage of progesterone only pill is this is the only pill that can be taken in the breastfeeding period. Normally, the combined oral contraception cannot be taken in the breastfeeding period because the breast supply will become less. It doesn't affect the baby, but the supply of the breast milk will decrease. Emergency contraceptive pill. So I think this is very interesting and important. Many people come to me like at least one OPD per day will be like asking for an emergency contraception. The thing is, you don't need to go to a doctor to take an emergency contraception. It's available over the counter. Yeah. As far as I know, it's available over the counter. It's in the name of I-pill or Plan B pill. These are the brand names. It basically contains a levonorgestrel progesterone. It should be taken within 3 days of an unprotected intercourse. When you take it within 3 days, it is almost 98% effective. That is, only 2% people will fall pregnant. if you still take the pill, and only 2% will fall pregnant. 98% will be protected from not having a pregnancy. The oral contraceptive pills have benefits other than contraception. So basically, it is given for a woman who has a heavier bleeding. Okay, so that means that the period becomes lighter. In fact, one of the treatment for heavy menstrual bleeding is a contraceptive pill itself. Like we try to give them progesterone related pills. If it doesn't work out, sometimes we might put the lady on a hormonal contraception itself. That time it is not given for a birth control, rather to prevent the heavy bleeding. Also, some people have after a medical abortion, they might have bleeding after a hysteroscopic procedure. That time to you keep the uterus calm, I usually put them on a contraceptive pill. That is, I clearly tell them I'm not aiming to prevent birth in you. I mean, not aiming to give a contraceptive pill to you for contraception, but rather to keep the uterus calm. So that means that the periods will usually be very light and very predictable. Most important thing is once you stop the pills, in the next 3-4 days, you will have a period. Many women with irregular periods come to us for regularizing the periods. Okay, see, naturally only you can regulate the period. Otherwise, we will usually give them a contraceptive pill to regulate the period. So you will have a very reliable day of getting the period every month. You are taking a contraceptive pill for some reason, even for heavy bleeding, it is obviously going to protect you from unwanted births also, because it's going to protect you from ovulation.